Hello, and thanks for joining us. My name is Adam Gilbert. I am the drummer for Columbus-based rock band Starset, and I am also a patient advocate for Green Health Docs based on 5th Avenue in Grandview Heights, Ohio. We are a patient care facility that is physician-run, and we help new patients get registered to get their medical marijuana recommendation on the Ohio Medical Marijuana Registry. Today, we are starting something very special. We are starting the first of many interviews on Green Health Doc's Medical Marijuana Media Outreach channel. We are going to be interviewing different people from around the state who are involved in this new medical marijuana process. And today, we have our first guest, Mahja. Thank you for joining us today. It's really great to have you.
Thank you, Adam. It's a pleasure to be here.
This is wonderful. So so to start things off, just tell me a little bit about yourself. This is just to let people kind of start getting the gist about what medical marijuana is.
Sure.
So your name and what you're affiliated with.
Yeah, absolutely. So my name is Mahja Sulemanjee. I'm the director for marketing and for community outreach for Herbology Dispensaries. We're a fantastic national company at this point. We started off really humbly, just with a few locations, and over the last 2 years have really been able to pull a lot of speed. So Ohio will be our 4th market that we'll be opening up in. We have 7 current markets that we have different operations going on with, but we'll have 2 properties here. So we have a wonderful dispensary opening in Newark, and then we have another dispensary opening in Cuyahoga Falls.
Oh, great.
So really, really excited to get that open. I guess when you think of Herbology, you can think of kind of a premier dispensary, right? That's what we're looking to do.
That sounds good.
Yeah.
And when are you planning on starting to, I guess, the process of sales?
Yeah.
When you open your doors?
So inspections and all that fun stuff to come down the line. We're hoping to have our doors open by February. Thinking probably about mid-February, end of February at the latest.
Okay.
So really, really soon.
That's awesome.
Yeah.
I know a lot of people, they can't wait.
Yeah.
Can you tell me what kind of patient education will you be able to provide for people when they want to look up the first step to going to a dispensary? Because I know many people don't get a chance to travel around the country and to see other operations. So this could be the very first time people see anything like this.
Yeah, I'm so glad you mentioned that, Adam, because you're right. Most of the folks who are coming into our dispensary are going to be brand new to medical cannabis. A good percentage of those folks have touched it once or twice in their lives at a younger age and now coming back to recircle and using it for a wellness tool. So education becomes really important to us. And that starts at the outreach level. So we have a team of folks who are dedicated to going out and educating the community. So we host things at libraries, we host things at the coffee shops in town. We partner with folks like you guys trying to do the outreach piece and really trying to get, physicians in the healthcare community on board, understanding what we're trying to do. So it starts externally for us as we get the community to understand. We do presentations, education for doctors, nurses, social workers.
Interviews like this.
Interviews like this, exactly. And then we go on to the PCs, the patient counselors in the actual location. And that same education then is almost a hand-holding case management type of a conversation.
Absolutely.
What's going on with you? How are you feeling? What symptoms are you looking to, really get away from? What's bothering you? And how can we curtail what's going to be dispensed to you to really suit each of your specific needs? So I call it patient-directed medicine, right?
That's great, yeah. That's very awesome. So as it moves forward, have you done any other interviews of this nature yet, or are people talking about this yet in the state of Ohio? I know it's legal in other places.
Yeah.
Very first.
Yeah,
all right, great.
Yeah, absolutely. This is really nice. So people are talking about the press is starting to come around slowly. I feel like it's the era of cannabis, right?
Mm-hmm.
The green rush and all of that. Everyone calls it. So the light is shining on our industry. It's time for us
it's
to really
it's
it's
frontier.
history. Absolutely.
That's cool.
Yeah. So we're just here trying to make sure that we get it off on the right foot. So no mistakes from day one. Making sure that the patients have really are the most important thing. So for any of our dispensaries to really be able to function the way we need, we want to make sure that our patients are getting the best customer experience that they can have, getting the most knowledgeable and latest of what they need to know, and then having product availability, which we know will be a little issue as things get started, but make it easier down the line.
As every new product has its growing pains.
Mm-hmm.
So what I'm going to say is along the bottom here, we're going to stream really fast some of the 21 qualifying conditions that you may have in order to get your medical marijuana card. It is a very easy process. Yeah. What I did was a friend of mine is also a medical marijuana patient. He came to Green Health Docs with me. All we had to do was get on their website. We had to look up some of the symptoms, some of the conditions as they are calling it, and There's a lot of different ways that people are able to get the medicine that they need.
Yeah.
Once they have come down to Green Health Docs, they got their medical prescription, they are getting the right information, and they want to come to the dispensary. What can they expect when they first walk in the door? Are they going to need to bring an ID?
Yeah.
Do you take cash or credit? See,
Yeah,
some of these
sure.
things are
Absolutely.
different all over the country, and anything you can give insight on that?
Yeah, absolutely. So, I always recommend when patients come in, definitely bring 2 forms of ID, right? They'll have their cannabis card with them at that time, and then something that shows there'll be some paperwork and registration. They'll be met with a security guard, and maybe not such a scary security guard, so,
Sure.
It's just maybe more of a receptionist type of a setting. But they come on in, and they fill out a little bit of paperwork, and as they do, they're greeted by a number of staff who just kind of walks them through the process. Definitely recommend them to bring cash. If they're not comfortable bringing cash, most of the dispensaries always have an ATM on site, so that's available. That way they don't have to exactly budget for, I only brought this much, I'm not sure exactly what to purchase. I usually say on your first visit, try not to leave with a ton of products. Let's try to really weigh into what's working well. So pick 1 or 2 things, one something for daytime, one something for nighttime, see what's going to work best for you, and then we can go ahead and manage that and change it throughout the weeks.
That's great.
So that works really well for patients. I think most important thing is bring a good positive attitude with you. Going into using cannabis, the most important thing is for new folks is to know that this is different, and you've probably never experienced something like this, or maybe in little ways of it, but to just give yourself the time and the opportunity to have an open mind going into
Absolutely.
this.
I was hoping you would say
Yeah,
that.
yeah.
Open mind about learning
Yeah.
and self-awareness. This is a very important time for us to help the right word spread. We understand that there's probably going to be some negative that this faces
Absolutely.
as I've seen for many years through the media and
Absolutely.
through some friends being in trouble, and we just want to make sure that the right word is getting out there. And I am very excited to be a part of this, and so excited, in fact, that when I'm not on tour, I was wondering, how could I maybe get a job if I wanted to work at a dispensary? Is there any qualifying conditions for that?
Absolutely. So this is a booming industry. There is so much opportunity for growth. As I mentioned, just from 3 years from where we started to where we are now, there's just a huge opportunity for folks. So get in while you can. I'm sure there's plenty of time. So there's people are rushing, but there's plenty of time for growth here. Yeah. We're in the first inning. We've got plenty more to play with here, and sure. I think that the best thing to do is know your facts, right? Understand the products, understand really the science side of things, and then decide on what side of the industry you really want to be. There's so much from the wholesale part of it and process growing and all of that cultivation. You've got your processing side, manufacturing, and all of that, and then you've got your dispensing side and the customer service piece and all of that. So you can really pick which way you want to go with this.
Sure.
So have a good understanding of that. Get yourself really, well up to date on these facts. And cannabis now is at a point where some of the brightest people in the world want to be part of this, right?
Absolutely.
So know your stuff and bring it to
Absolutely.
the table.
That's great.
But you can go on our website and apply there. If you go to herbologydispensary.com, click on the career section, everything will pop up that's being populated, and then you can apply right there. So we're always looking to hire locally. I think that is the best thing.
Yeah.
We focus a lot of our efforts on local efforts. Yeah.
That's great. I'll mention real quick, I travel quite extensively around the
Right.
world. And one important thing that I try to always maintain in my life is a good relationship with people that I value, and I don't want to leave people when I come back and all of a sudden desert, say, Green Health Docs. I found Green Health Docs. There was a couple different doctors that were giving the prescriptions, but after reading through and actually already knowing a couple people that were involved in the process, it really helped the foundation for my belief in the green health, the movement that it is helping create and continue in a positive way. Can you expect to see, like if Herbology opening in, you said Newark and Cuyahoga Falls, what type of products are you going to be selling there? Are you going to, is it just Christmas time Toys R Us, or is it going to be specific to certain things,
Sure.
certain products as we grow along?
Sure, yeah. So absolutely, the first 6 months will look very different from the end half of that latter 6 months. So I think coming into the new markets, it's all really relevant on what the cultivators are growing. So depending on what's going to be available, and giving them time to make sure that their harvests and their crops are the way that they need them to be
Sure.
is a really big part of all of this. Making sure that their genetics products are what they want them to be, that they're, all of their equipment from the lighting to the, every little piece from the humidity in the room, all of that is in play. It takes time to really get these things, and that's how you get a scalable medication, something that's the same throughout the whole year.
Very true,
And
yes.
that's what we're looking to try to create, and that takes time for some of these cultivators, so we understand that, and we're patient with them as they get their processes in place. But you can see things like, traditional dry herb, of course, flower coming into the different locations for vape purposes. You'll see a lot of vape pens, which are a really, really big part of the market. They're discreet.
Preaching to the choir.
Yeah, exactly. They're discreet, and they are a lot of times odorless, and so they're just a really nice form, and they don't have the combustion, associated with some of the smoke. So people like that.
Some of the stigma involved is some of the stench.
Absolutely.
And people are like, oh my gosh. When, other parts of the world that have things going on, they realize that it's not quite as offensive, but there needs to still be the understanding before we can just be walking down having a parade down the middle of High Street.
Absolutely. And and there's a reason for that stench, right? I mean, these are the terpenes. These are what's causing a lot of the effects for the folks that are getting therapeutic use out of it. So there's a reason for all of that, and so we'll see those things on the market. We'll see tinctures, which are a phenomenal way to medicate. A couple of drops on the tongue, swish it around in your mouth if you can. It goes in sublingually. Really, really effective for patients to medicate that way. You'll see oils coming down the line. These have been, tremendous amount of use. Very potent medication. Again, a little bit goes a long way. You'll see a lot of things coming out in microdosing too. Smaller amounts of things that you can dose with, right?
Yeah.
Small amounts versus having to worry about taking large amounts, especially for those new people. That's going to be an important part of it, starting at 2.5 or 5 milligrams of what to take. So you'll see capsules, you'll see tablets coming out. You'll even go as far as eventually seeing patches, topicals, of course, which are available, even suppositories, believe it or not. So yeah, quite a few different types of products. But again, there's a need for these things, right? It makes sense for why people are using it for these medical conditions, and you'll really see the market develop to what the patient's needs are and the demand generated by our patients, right?
Right, because not everyone wants to commit to smoking a big, a nice big pre-roll versus someone who just needs a little bit just because their back is aching from a 20-year ago accident that they had. And so that's very great information. Where do you guys get your products from? Do you get, is it Ohio grown?
Everything is Ohio grown. So state law is that we can only purchase from the state that we're operating in. So all of the cultivators here in Ohio, once they're up and operational, we would love to do business, of course, with all of them, carry a large variety of inventory so that we can really suit our patients' needs the best that we need to. From a dispensary standpoint, we look at that as what products are what variety can we offer for those patients. So we'll be working with just about all of them.
Okay, cool. And the one, I won't mention a name here, but the place I heard about that will be opening somewhat soon that Green Health may be involved with, that we are hoping to get an interview with, that's basically a laboratory, but people don't really always see medical marijuana grow operations as a laboratory. I mean, to me, because I'm an advocate for this, I see it as a tomato right now because I see it, how it affects me and how it helps me and how I'm excited to see these operations grow, and doesn't have to be a closed door operation. Do you see those, are they going to be opening their doors for people to be able to go and see this, or is that the laboratory, mentality, is it going to be super clean?
Sure, yeah, absolutely. So when you think about these large-scale cultivation processing organizations, so everything is relatively pretty sterile in those locations, right? We want to make sure that we're following all of the guidelines that there can be, from the simple hair nets to having scrubs on, right? You're going to really see a very healthcare type of a driven area. So people are surprised because, they think of there's just going to be these, cannabis plants just all over the place, but the way that they're rowed out, the way that, the lighting from the temperature to the humidity, all those things I talk about are controlled. The different stages in the plant's life and how they're moved strategically and accounted for from one piece to the next stage. Yeah, absolutely. And then just genetics and the cloning and all of that piece that's happening with it. It's so scientific. Yeah. And then you look at the extraction laboratories, and then that's where the fun begins. And you've got this, these unbelievable state-of-the-art equipment for extraction, and people are thinking different extraction methods work better than others, but this is a skill. This is organic chemistry that's very vast,
Absolutely,
right?
Yeah.
So really pulling in people with a high amount of chemistry knowledge. You'll find that in our, we call them weed scientists, right? But they're impeccable at what they do, and you get such a wide variety of products from it and different concentrations of the THC or CBD or whatever products you're looking to get. So it's really interesting. But these laboratories, exactly, you can call them laboratories, and we follow all of those OSHA guidelines and all of that we have to. Yeah.
So even if someone doesn't really want to get a job in the medical marijuana industry, I still recommend taking your time. If you're sitting on the couch anyways, pull up your laptop or your phone, do some research, learn about what you're a part of, learn how you can make it grow in the right way, no pun intended. Learn how you can help your friends. Don't press it on anyone. We want this to be an open-minded, a movement that you are willing to join into, but we really want to make sure that as we move forward, we're going to keep it positive, and we're going to try to keep making friends.
Absolutely.
And making this grow. So is there anything else that you want to add on to this?
No, not too much. I just want to thank you guys for putting on this great event.
This
yeah,
is
absolutely.
awesome.
This is a great opportunity to get the voice of cannabis heard and to kind of show a little bit more of the faces of cannabis, right? There's such a diverse background here.
There's so many people that you wouldn't expect that I think they're waiting to be advocates for it, but maybe they're a little afraid. So let's start making friends and make this a positive medical marijuana outreach. So thanks, guys, and join us again. Thanks, Mahja.
Thanks, Adam.